Hey everybody, this is Kevin Ring, president of FAM. Thank you for joining us for our second Facebook Live today. This morning we talked about federal compassionate release, and if you missed it, it is going to be housed on our webpage and our Facebook page, and you can watch it later. We want to focus today on what's happening in the states, what's also happening in the federal space outside of compassionate release, but we wanted to focus solely on that because of the emergency project we had going there. I'm really grateful to have Udi Ofer, who is with the ACLU, and to share his insights, all the incredible work they're doing across the country. Their reach is a lot farther than ours. They're much bigger. And so I want to talk about what we're doing, and I'm going to ask Udi for his insights, and he'll be helpful in answering some questions about what's going on in the States. I just want to start with a preliminary matter. First, we are very sympathetic to the plight and the ordeal of many of you and what you're going through right now. As an organization that works directly with thousands of families every day and hears from you by phone and email and by Facebook, we understand the sense of urgency that you have. As many of you know, I was in prison for a short period of time, and I know my family worried about me every day, and that wasn't during a pandemic. And so I can't even imagine the stress you're going through. I know you're hearing about reports about people dying, people getting sick, and in some cases not getting any information. And that can be even more frightening when you're not hearing from your loved one. So I just want to say, we understand the gravity of this. And, I know our organizations and others are working as hard and fast as we can to try to move lawmakers and the courts to do the right thing and to protect our incarcerated loved ones. So I just want to say, and I'll come back to this later, I also know that you really have to take care of yourself when you're going through this. This is a really stressful time. And so we want to make sure that you're taking care of yourself so you can be the best advocate that you can be for your loved one and for the loved ones that you still have in your life right now who need you and are depending on you. And so you need to find some balance. And we're going to talk more about that. I just want to say, from FAM's perspective, we've been focused on something. There's been a lot of talk about, sanitizer and good practices in prison, and we support all of those efforts. But at the end of the day, the best move right now is to safely decarcerate. The only way we're going to get anything close to social distancing or to protect the most vulnerable people is to get them out of prison. So we've really been focused on policies and strategies that move that ball forward. That's what our federal compassion release program is about. And, we look at what a lot of the sheriffs are doing at the front line in the counties, at the jail level, where they're having to decide whether to detain somebody that has broken the law. And these are tough calls they're having to make. And you see a lot of people on the front lines here, in order to protect public health, saying they're going to hold off on putting more people in their jail and exposing them to this deadly virus. And what has been so frustrating for us is that at the state level and federal level, we have the most vulnerable populations in there that don't even need to be there, didn't need to be there before this crisis. And we're not seeing action, or at least fast enough action, to release those people. So that's really been a frustration of ours. I'm sure Udi shares it, and we'll talk more about that. One thing I'll say about the state level too is there's been a lot of focus on, why aren't the states acting? In some cases, the states don't have the authority you think they have. In the federal compassion release program, that, especially as it's been reformed by the First Step Act, there is a process for getting people out and letting them get to the courts. In the states, their compassion release programs are not as vibrant. There is not the same right of appeal to the courts. And even the governor or the Department of Corrections does not have the authority to let people go. So we're also trying to make sure that these states know what authority they do have. In a lot of cases, governors do have clemency authority. And one thing that we may end up talking about is the power of reprieves. This is basically something that hadn't been talked a lot about before. When people think of clemency, they think the governor or the president can issue a pardon, or they can commute a sentence or shorten a sentence. They also, at least in 30 states, have basically unfettered power to grant reprieves, which suspends a sentence. And so you could get people out of harm's way during this crisis and then save lives. So that's something we've been pushing on in Pennsylvania and in other states. It has been something of a frustration for all of us to see that governors are taking, well, many governors anyway, are taking extraordinary precautions when it comes to all of us on the outside. We are shutting down schools. We're shutting down businesses at gunpoint, using the police authority to stop this kind of activity. And yet we don't see anywhere near the emergency measures happening inside prisons. And that has been really troubling. And so we know that the governors, if they have the authority to take these other extraordinary measures they're taking, could do more in this space. And so we're focused on that as well. I think one thing that UDI and ACLU and FAM share a commitment to is that if the political branches fail, we want to give the courts the opportunity to do the right thing. And I know they're doing a lot in terms of lawsuits, which I think he'll talk about, but that's also why we're pursuing compassionate release, because if the BOP and the White House don't do enough, then, and Congress has not stepped up, then we want to make sure people can get to court where judges will have the opportunity to protect people. In addition to sort of safe decarceration, another priority of ours is making sure that there's greater transparency in what's happening. We know a lot of families are worried, and we don't blame you, and this is a very stressful time. But there's a lot of rumors going around, and not all of the states are sharing information about what kind of testing they're doing, or what their numbers look like, or what kind of, if they're using quarantines. And then when there's lockdowns, there's even less communication. So some of you saw that in a handful of states, we've written letters and told them to start posting dashboards that are being done in other states that share on a daily basis how many people are testing, what are the results, and things like that. Now, I think there's skepticism about whether these numbers are accurate. I share that skepticism, but at least it gives people a sense. We now know that the federal prisons, their rate of infection is growing quickly. We know what's happening at Rikers in New York. So that information, I think, is helpful. It can be frightening, but it also can be, it can allay fears, because some facilities, they don't have the same concerns yet. And so we want to make sure that families have information. The other way we want trying to protect communication is we've joined with Color of Change and Worth Rises to on a petition that you can find on our COVID webpage to make sure that people are getting free phone calls and email access to their loved ones. It's really important that the lines of communication are open. We're concerned about what lockdowns and quarantines are going to do to that. So we're watching that closely, but we think it's crazy at a time where the federal government is sending people money because they realize this is a desperate time to then let companies extort high fees in order to stay in touch with their incarcerated loved ones. I'll ask Alexis to share with you briefly our COVID resource webpage. There's a lot of actions you can take, some in the states that we're working in, and then some that are just general actions. I know there's a lot of fear and there's a lot of helplessness that there's not much you can do, and people are, calling all sorts of offices. And we encourage you to do that, but, be smart. I know the ACLU has a lot of actions that people can take. Oh, I think here it comes, yeah. So this is our COVID webpage, and there's a bunch of actions you can take in addition to explaining what the Federal Compassion Release Program is and how to take advantage of that, or at least our efforts to help with that. There's resources about different pages, what they're doing, states that have dashboards that are sharing information about the infections in their institutions, and then ways to take action. So we encourage you to do that. And I think right now I'm gonna ask Udi to introduce himself and talk a little bit about what they're doing, and then we already have tons of questions queued up, and we want to get to that so we can be as much of a help. I will say, if we don't get to your question, it'll be posted below this video on our Facebook page, and we'll come in later and answer that. Our staff and others will be able to answer those questions. If you didn't watch this video live and you're watching a recording of it now, post questions below that and we'll get to those as well. And now I'm really grateful that Udi at the last minute was willing to join us, because, like I said, they have incredible reach. They're doing some phenomenal work. I do think a smart thing they're doing, and the ACLU does better than anyone, is go to court and sue to protect, endangered rights. And right now, our incarcerated neighbors are being forgotten, and they are trying to make sure that we give them they are guaranteed a modicum of health care. And in this, pandemic, it's not clear that's being honored. And so I'm grateful for what they're doing, and I'm grateful for Udi for joining us now.
Great, thank you, Kevin. It's actually an incredible honor to be here, since I'm such a huge fan of FAM, and think that FAM has been doing some of the most important work in the nation around, fighting the crisis of mass incarceration, particularly in federal prisons. So look, from the ACLU perspective, right, mass incarceration was a public health crisis before COVID-19, and it's an even bigger public health crisis after. And what we have been doing over the last, month or so is really following the advice of public health experts who have said that any public health response to COVID-19 should include reducing the footprint of the nation's criminal legal system. So reducing the number of people in prisons and jails in the United States. And that includes by releasing people who are most vulnerable, and primarily the elderly and the sick, but also stop funneling people into the system in the first place, right? As I'm sure everyone knows, there are about 10.5 million admissions a year into our nation's jails. Every 3 seconds in America, the police make an arrest. And every one of those arrests, almost in every circumstance, means some time spent in jail. So we have to stop funneling people into the system in the first place and get people out who are most vulnerable. And the public health rationale is pretty straightforward, right? The two things the public health experts are recommending for all Americans are social distancing and proper hygiene. And those are two things that are almost impossible to find in most of our nation's prisons and jails. So that is the vantage point. That is the, how we're approaching this issue, right? That this pandemic has exposed the full extent of our nation's mass incarceration crisis. We approach this with the realization that about 40% of incarcerated people already suffer from a chronic health condition. Our medical systems in our prisons and jails and in communities from where most people who are in prison and jail come from were already failing. And this crisis has just taken on an even more urgent need because people are dying. So what has the ACLU been doing? Litigation is definitely a part of it, Kevin, and it's an important part. But actually, I got to say, I mean, a lot of our successes so far has been in conversations with governors and with local stakeholders. So the ACLU has been working in about 40 states over the past 3 weeks to pressure governors, prosecutors, and sheriffs to reduce their jail and prison populations. We have active conversations with governors in about 24 of those states, where there are conversations happening, where we've shared our model executive order and other policy ideas. We're running outside kind of pressure campaigns in about 10 states. And we're already starting to see results, right? And please don't read anything. What I'm saying is that we're anywhere close to where we need to be. I mean, this is just a drop in the bucket of what's needed. But I'm also heartened to know that we are starting to see some results. So for example, Colorado, we've already seen the jail population in Colorado be reduced by about 34% since the beginning of the year. So thousands of fewer people are already in jail in Colorado. And a lot of that is because the governor there, working with many stakeholders, advocacy organizations, issued an executive order asking the criminal justice stakeholders to work to reduce the number of people detained in jails and in prisons. And we're starting to see local stakeholders act. Now, we need a lot more, and we actually are filing a lawsuit today to get the Supreme Court there involved as well. But we're seeing also a lot of positive things happening. Michigan, the governor there also issued an executive order that will expand early release from prison. And we believe if implemented correctly, could lead to many fewer people. In Wisconsin, we've seen the governor and the Department of Corrections there begin to take important actions, including releasing more than 1,000 people who are currently on supervision holds, committing to release people on earned release, and also people in Milwaukee jails who are in for technical violations. Kentucky also took an important step yesterday, releasing 186 people immediately, but potentially releasing hundreds more in the coming weeks who have 6 months left on their sentence. Los Angeles County, we've seen the sheriff there release 1,700 people from jail, really focusing on changing bail practices and releasing people who only have 30 days remaining on their sentence. And I gotta say, I think the best legal decision so far, although I expect there to be many more ones in the coming weeks, so far comes from the New Jersey Supreme Court, where the ACLU New Jersey there and the Public Defender's Office filed an emergency petition, and the court there ordered 700 people to be released who were being incarcerated on probation violations and low-level offenses. So we're seeing things happen. Now, again, the primary point that I want to make is that we need a lot more. This is a crisis situation. We have 2.3 million people incarcerated in the nation's jails and prisons. The United States has the highest incarceration rate in the world, both per capita and by volume, and we need more action. I'll end with a bright note. We actually did a poll of registered voters a couple of weeks ago, and we released the results earlier this week. And it was promising. Our poll found strong bipartisan support for releasing people from prison and jails who are most vulnerable to COVID-19. 63% of registered voters supported releasing vulnerable populations from prisons and jails as a way to stop the spread of COVID-19. This also included releasing pretrial detainees who haven't been convicted of a crime. And this included the majority of Republicans and the majority of independents. So 53% of Republicans, registered voters, support releasing people, 59% of independents, and 73% of Democrats. So the public is on our side. I think the issue is more, we need governors, we need the president of the United States, we need local sheriffs and prosecutors to step up and give this the type of urgency and aggressive response that it deserves. Since this is, a huge public health crisis, not only impacting us who are living outside of prisons, but particularly impacting people who are living in prisons and jails.
Udi, I'm going to jump into the questions, but first I'm going to ask you, what do you think? You've seen the criticism, especially in New York, about some of the releases that there were people who were convicted of sex offenses who are getting out, and these are people I understand who are just in on technical violations. They're not in prison serving time for their offense. And so I've seen even people who are usually sympathetic to reform balking at the idea that some of these jails should be issuing these releases. What do you say to that?
Yeah, look, I mean, I think the same sort of, fear-mongering and scare tactics that we saw before COVID-19, you see it amplified in certain circumstances here, which is why I believe the best thing for the advocacy community right now, for the criminal justice reform movement right now, is really just to follow the advice of public health experts and let them be on the front lines, the ones who are making this case, right? This is not the ACLU or FAM saying, the elderly and people with underlying conditions are going to die unless we provide them the social distancing and the proper hygiene that they need. And the best mechanism to that is to bring them home. These are public health experts. So that's the approach that we've taken. But look, we're always going to have the fear mongering. We know that's part of this business, unfortunately. But we just need to keep our eyes on the prize. And the prize right now is literally saving people's lives.
Yeah, I try to tell people that these people were not sentenced to die in prison. That was not part of their sentence.
Right now they are. I mean, look, Patrick Jones, the first person to die in federal prison, was in for a drug offense.
Right.
And actually filed a petition under the First Step Act to be released. He should have been released. The prosecutor fought that case. Patrick lost, and now he's dead.
Right. Well, and I also say that I think it's a time to be, it's a crisis, and all we're asking for, in your case, especially with bail reform and the rest, and what we're seeking in compassionate release is these are people we don't think should be in prison anyway.
Right.
So we're not asking, even in the best of times, these are policies that lawmakers should adopt. And, so the fact that we're in this public health crisis, even more so. I do want to mention this because we've reached out to the White House, and there's been some confusion about the Barr memo and what impact that would have. We were skeptical because they put a lot of limits on who would qualify. There was also questions we were getting from family members about, do we apply or are they going to seek us out? And the White House has said in the last 24 hours, they've approved 391 applications for home confinement. And today, we are hearing from families with loved ones at Jessup, at Coleman, and at Danbury, the women's prison, that there have been announcements, people are being called, 25 women in Danbury, they're being sent to quarantine for 14 days and home. So there's some evidence that they're starting to move on this. I think you and I are going to say the same thing, which is there's a lot more that needs to be done. But I think the politics are just going to move to where the crisis is, right? And until we see greater rates of infection, which we're going to think is too late, I think they think the politics is going to be, we'll move as fast as, we have the public will to do this. And so I hope that's not the case, because of what you're seeing in Oakdale, where you're having, now a few deaths. Butner is infected. I know that's happening in Rikers. And so I hope they'll move faster. But I think, like you said, there's some signs of hope. And I also think that for our loved ones watching, this is really not a time where if you have somebody who's young and healthy and serving a long sentence for, a violent offense, this is not going to be an easy lift. This is still going to be a focus in on those who are at the end of their sentence, or they're, elderly or sick, or they're pretrial. I think those are still going to be the areas we're going to see the most opportunity for relief. And I would say this, though, we all benefit from thinning out the prison and jail population, because it allows for better, not perfect social distancing, but better than what we have now when these places are full.
Yeah.
So with that, go ahead, and I'm going to jump into questions.
Yeah, I would just add one more category where we're seeing momentum in the States, and that's people who are in for technical violations. We've seen New Jersey Supreme Court decision, we're seeing action in Wisconsin, and that's a huge population where there's a recognition that if you're in for a technical violation of parole or probation, regardless of age, you shouldn't have been there in the first place. And if we need to, reduce the populations, this is a population we should look at. So I would just add to that. The last thing I'll say is everything that you just said, I agree with. One of the points that we're making with government stakeholders is that the populations that we're focusing on, the ones that you mentioned, the elderly, the sick, are also the ones that have the lowest recidivism rate.
Yes. Yes.
So, so any fear around public safety is misplaced right now. So the pitch that we're making is this is not only good for public safety, but it's also good for public health. And,
right.
and I think in the same way that we've seen the federal government change how it initially responded in general to COVID-19, I'm hoping that we're going to see Attorney General Barr and the president also begin to change.
So you and I were supposed to have a phone call, which we haven't done. So now if I use that whole hour, us talking, I'm going to get killed by ours. Yeah. No, it's good. It's good. We'll catch up afterwards. I'm going to just start. What if the facility that your loved one in is informing them that the virus is present and the guards have no compassion? Well, guards having no compassion is as old as time. I will say this. We should not see each other as adversaries in this process. In the District of Columbia, where there's been a suit against the DC jail, you've seen the corrections officers join that suit. Corrections officers don't benefit from this pandemic either. And we're seeing, they realize they're the carriers of it. They're the ones who are bringing it in and out. They have families. They don't want to infect. And they don't want to be around a sick population. So I think the interests are more together than they usually are. But in terms of the institution having the virus already inside it, this was what we thought was so fraudulent about the Attorney General's claim that for some people being in prison is the safest place for them because they're quarantined and then they have medical care. There's not great medical care in any facility. I think what the ACLU is doing has been doing for years in Arizona is exposing that. And so you're seeing bad systems get exposed even further now. If I would be reaching out to those facilities and asking what they're doing then. I mean, are they taking those people out? Some of the problems is if this is a federal facility or some states where they're camp-like environments, you can't have a lockdown in a cell. You're in a big open room. And so the question is, what are they doing to remove these people? I heard a lot today that masks were handed out in federal facilities. These are steps that should have been taken before, but you have to be your loved one's best advocate. You should not feel hesitant about calling the facility, asking for the warden or their executive assistant, and asking what they're doing. That's true at the federal prison level or at the county jail level. Would you add to that?
I agree with everything you said.
Okay. A dear friend who's incoming inmate is supposed to report May 5th, is 67 years old, with a 2-year sentence to a camp for a nonviolent offense. A lot of people have asked us about this because we're doing the compassion release push and people are saying, what's available for people who haven't reported yet? Compassion release is not part of the answer. I think, at least at the federal level, they're not asking people to self-report right now. But I don't know what's happening overall. I think people are getting their dates pushed back, even sentences are being pushed back, sentencings are pushed back. So I would be reaching out to see if you can delay that. There's no reason not to, but do you know what's, I mean, and at the state level, it seems that in some cases, the prisons don't want to take anybody more from the jails. So that, and then the jails are getting overfilled, and that's why they're trying to reduce their population. But if somebody's just getting convicted now, do you have advice for that?
Well, I think this is where you have to work with your individual lawyer. I mean,
Yeah.
and this is where a lot of it is going to depend on prosecutorial practices, which is why we're focusing so heavily. And Miriam Krinsky over at Fair and Just Prosecution is doing incredible work in working with prosecutors across the nation to respond with the type of urgency this needs. So a lot of this depends on your own, what you could get the prosecutor to agree to.
Yes. I think that's right. Another one, again, questions about home confinement. I would, go to our webpage and look, because the Attorney General, at least the federal level, set some pretty strict limits on who could get it. I mean, part of the reason compassionate release is a good alternative is because it doesn't matter what offense you committed. If you're vulnerable and, it doesn't matter what your offense was, there's no limits. And so we're seeing people who committed different types of offenses, as long as they qualify otherwise, can get out. Home confinement, I don't think that's going to be the case. The Attorney General is really looking for people who are older, who have some signs of sickness, pre-existing conditions, asthma, those types of things. So there's going to be limits on that. In all of these cases, too, they're going to make sure that you have a home plan. They're not going to send somebody out at the federal or state level who doesn't have a place to go to. They're not worried about employment, but they want to make sure that you have health care, that you're going to be eligible for Medicaid or Medicare, and that you have a home to go to.
Oh, one quick thing I'll add on that. So the federal stimulus package that included that was the CARES Act, included very good provision on home confinement. Unfortunately, the directive issued by Attorney General Barr restricted or limited how it could be applied, and one of the ways it's limited it is through the use of a risk assessment test called Pattern, which we have had concerns with for a while. But it is going to automatically, if all the cases are going to be run through Pattern, it will immediately remove some of the most important cases that we do think should be eligible for home confinement. And then there are also racial justice concerns associated with this risk assessment tool. It's my understanding that right now, under this risk assessment tool, only 7% of the population that would be eligible for home confinement would be Black people, even though Black people make up about 40% of the incarcerated population. So while Congress gave the Justice Department broad authority to use home confinement, unfortunately, the Justice Department right now is taking a much more limited approach on how to do it, and we're trying to get them to change that.
Well, one thing, yeah, I agree with that, all of that. I would say one thing that I thought was encouraging, though, by the fact that they were calling people today at these facilities, means that they're actively seeking them out, because a lot of families had questions whether they were going to have to apply. Now, people are asking for it, but some of the feedback was that people were being told, yes, you're eligible. You're not on the list yet, but eligible to me means they're checking their pattern scores or other things, but at least they're seeking them out. And if they're being proactive, I think that's a good start. I agree with you. The parameters should be widened. As far as releasing state inmates due to COVID-19, seems to be a tougher challenge because of the individual state laws. This person has a loved one who's serving a mandatory minimum in Iowa, and they're wondering whether there should be how they could reduce their how much time they have to serve under the mandatory from, say, 70 to 50%. This is another thing where we're in a crisis, and a lot of the state legislatures have gone home for reasons that make some sense, but has made it hard to get emergency action, which is why I think ACLU and others are rightly focused on governors. In that case in particular, I don't know what the governor's authority is, like as in the federal level, to extend home confinement to people. It matters what their authorities are. I mean, I don't know what the governor's reprieve power is there. I don't know if they have a board actually there. In some states, governors have unfettered authority and some they don't. But getting a change from like 70 to 50% time served, that usually takes a legislative act. And the legislatures are mostly out of session. I know Pennsylvania's and some others are. In Florida, we've asked our legislature to come back to address some problems, and they have not. But if you need legislative change, that's going to be hard in this environment.
Yeah. Which is why we're focusing a lot on governors using their clemency powers. I don't know off the top of my head what those powers are in Iowa. Because in about half the states, governors don't really have unilateral clemency powers. They need to go through some sort of clemency board. Sometimes the attorney general needs to agree to it. But that's why so much of our focus has been on clemency, has been on administrative changes that the governor can do on his or her own with their DOC commissioner. So that's why technical violations, that's an easy one, or an easier one. But yeah, people serving mandatory minimums normally would require legislative change. But we need governors to use their clemency power. So by the way, whoever asked that question, if they want to contact the ACLU, please do contact the ACLU in Iowa, or contact us in the national ACLU, and we could see what we could do.
Yeah, thank you. There was a question about lawmakers and governors not responding. Let me just say this. As an advocacy organization, we don't always get answers either. We had a nice experience this week where we wrote to the Department of Corrections head in North Carolina and said, you don't have a dashboard. Your families are in the dark about what you're doing in terms of testing and to keep their loved ones safe. And they replied within a day and said, thanks for that idea. We're going to talk to our IT department and put up a dashboard. So that was nice. I have to say, that's not usually the case. And I think we have to extend grace to people who are really working hard as well. The governors and lawmakers, they deserve a lot of grief for not fixing these problems ahead of time. But it does not surprise me that you're not getting answers right away. I will say that some of the actions that we have set up, if you go to the our COVID resources page, when we have written to people, there's a general letter that says protect our loved ones, and it has a list of things that we want: safe decarceration, hand sanitizer, soap, the basic things you would say. I wrote to my Maryland lawmakers. I got a response. I know others have as well. So there is no rule of advocacy that says you're going to get a response, but I can assure you that it's time to be the squeaky wheel and to let people know, because this is a forgotten population. I really have thought since the beginning that, all of our families, all of our neighbors, I have neighbors being laid off. I have, I know friends of friends who are sick with this. Prison population gets forgot about in the best of times. In a time of crisis, it's very easy to ignore them. It doesn't have to be because you don't care at all about them. It's just because you're not thinking about them. They're not front of mind because everyone's got their own concerns. Governors are dealing with a lot of issues, getting ventilators to their state and all the rest. So I just say, stay on it. And if you're not getting a response, call somebody else. Just, keep at it. Work smart. I mean, not only hard, but work smart. Try to make sure you're talking to your representatives, and you're not, if you're calling people who are not, you're not a constituent of theirs, they're not likely to respond to you. So make sure you're using, petitions and forms that get it to your lawmaker, and make sure that that's the case, or you make calls. I'm sure the ACLU has tons of action set up. We do as well, again, on our page. But I would just tell you, don't get discouraged. Do what you can, and don't expect an answer every time. That doesn't mean that they're not getting it. Let's see what else. Yeah, I see. Oh no, this is from a governor about governor. Any information on deporting or releasing nonviolent drug offenses, INS held inmates that are at the end of their sentence? Can you address that, Udi?
I'm not sure what the question is. I do know that, we've seen the same sort of decarceration actions that we are trying to get in our nation's jails and prisons, also in our detention centers, immigration detention centers. I'm here in New Jersey right now, and I know that the ACLU of New Jersey was able to sue and get, I think, a handful of people out. I know there are legal actions all over the country. In some ways, the litigation is more, is easier, quote unquote, in the immigration context, because remember, most people who are incarcerated are under civil law. They're considered like civil detainees, where the law, where technically the incarceration is not supposed to be a form of punishment. And I think now with the spread of COVID-19, we can make a stronger case under the law. So it's more comparable to pretrial detainees in the jail context. But there's a lot of movement. The space that we're in, which is the criminal justice space, there's a parallel track in the immigrants' rights space where people are working frantically to get people out of immigration detention.
I was just going to say to our staff, Rabia, the chat page is, I can't adjust it up and down, so I'm not seeing. I'm seeing a lot of comments from our staff, but I'm not seeing the questions anymore. I mean, they're cut off. So I see one about RDAP, but I can't. I'm just getting the bottom of it. I don't know if I'm able to adjust that or.
Are you not seeing the questions from me on the chat?
I did, but now we're at the bottom of the chat, and so
there's because I haven't feeded there. There aren't any more questions.
But I missed some up higher.
Okay.
So is there a way to scroll down or
on the chat? You should be able to scroll.
Yeah, I can't.
If you're not able to scroll, some of the questions they did have were about specific states.
Okay.
One of them specifically is about South Carolina and what's happening there. They want to know what's being done in South Carolina specifically.
Udi, do you know anything?
Yeah, you know what? I'm going to pull up our spreadsheet while we're talking. I don't have any information on South Carolina that I could share.
I know that they just yesterday put up their dashboard, and I know from Teresa, who's in our Families in Action Facebook group, that there's a great concern that it's inaccurate, that people are testing positive, both officers and residents, and that that information is not being shared yet. So there's great concern that it's spreading. I have not heard anything about releases. I believe ACLU, I remember her sharing with us.
Actually, we have litigation going on in South Carolina. I'm trying to pull it up. It's so hard to keep track of everything happening right now.
Yeah, I know you guys have action there though.
Yeah, I'm trying to pull it up as we speak.
Okay. Does anyone know if releases are being done at FMC Rochester? FAM, prior to this, my husband, I haven't heard about that. I would say stay in the Families in Action page, because we're starting to see people sharing news of releases. That's how we heard about the other ones at the other federal facilities. You know, people are sharing that their loved ones or people that they're serving with have gotten calls by the warden to be sent to quarantine. So, you know, the best place to do is stay with the group, and you'll get updates from others. That's the best thing about the crowdsourcing of that page.
So can I just later on share on your Facebook page the information on South Carolina?
Yeah.
I'll do that.
Udi, I just like to say, people are asking about the mechanisms for release in the different states, and we've talked a little bit about this. You know, I would just say as a initial matter for people, go to our webpage. If you're asking about compassionate release, because we talk so much about it at the federal level, our general counsel, Mary Price, wrote a report a year ago called Everywhere and Nowhere. And it basically details how every state except for Iowa has some sort of compassionate release program, usually called medical parole or geriatric parole, but they don't grant a lot of releases. Many states are behind the federal model, and they're very limited. And so very few people are getting out. So that's not a very fruitful alternative at the state level, at least as they're currently constituted. So that's why, and with the legislatures being out and not making changes, this is why so much of the attention has been on the executive branch and on governors. And again, we can post some of the research about what governors do have authority. In Pennsylvania, Governor Wolf has basically unfettered power to issue reprieves, and we have, and a bunch of other advocates, including ACLU Pennsylvania, who we've been working with very closely, and Right on Crime and Americans for Prosperity across the political spectrum have been pushing Governor Wolf to use that authority, because anything they get through the legislature is going to tend to be modest. And the bill they're even considering in Pennsylvania is going to focus in on the lowest level nonviolent offenders who are within a year of the door. And the thought is, yes, those aren't the vulnerable people, but at least they'll get some people out and you'll create some space. But to get some of the more long-serving elderly people out, in a lot of cases, those people committed crimes of violence, even if it was a long time ago, and even if there's no risk of reoffending. And so that's going to usually take executive action. And I know some people have said, well, and I heard the president say the other day, you know, they're letting out violent offenders. I would just say, we've got to distinguish, you know, violence, nonviolence is not the distinction we should be making. Yes, there are people who committed crimes of violence when they were younger, and they have no trace of violence today. A lot of people know Matthew Charles, who is FAM's fellow and was in prison for 35 years on a federal drug offense. Before that, at the state level, he had committed a violent crime and served his time for that. People change. And we know from evidence that people age out of crime, especially violent crime. That's a young man's game. And so if we're going to get the most vulnerable people out of prison, we can't make this a binary violent versus nonviolent distinction. You want to talk any more about sort of gubernatorial power or state power?
Yeah, first of all, I got information on South Carolina. So on March 16, the Supreme Court of South Carolina issued a directive to local judges, sheriffs, and magistrates with a whole series of actions the localities can do. I will share that order on the Facebook page later on. And then there's a whole ton of other advocacy. Okay, in terms of who are the stakeholders who could actually work. So I actually wrote a blog piece on this about 2 weeks ago. It's on the ACLU.org website that breaks down all of the powers the different stakeholders in the states have to decarcerate. Obviously, as Kevin mentioned, at the top is the governor. Governors just have tremendous authority, particularly through commutations, reprievals. So that is why we are focusing heavily on governors, also because our criminal justice system is so decentralized that we don't have one criminal justice system in the US. We have at least 3,000 of them. And we can't go system by system right now. We need the top executive on top, to act, which is why we're focusing on governors and chief justices. Parole boards are the other, big category. Again, different in every state, but in pretty much every state, there's a huge docket of pending parole petitions, and these parole boards could act quicker and faster to get people out. Beyond that, you have a DOC commissioner, and that's kind of under a governor, where they could change, their administrative regulations around who gets picked up for a technical violation of parole or probation, which is a huge feeder of mass incarceration. Somewhere like Wisconsin, 1/3 of all people who are incarcerated are in for technical violations of parole. And this is something where the DOC commissioner could get people out. They could also file motions with, for reconsideration. And then really the most local are prosecutors and sheriffs, right? I think everyone has seen I think one of the greatest successes of the criminal justice reform movement of the last couple of years is showcasing the vast majority, the power that prosecutors have to end mass incarceration, because they have fueled mass incarceration, right? 95% of all cases, all guilty verdicts in the United States are a result of a plea bargain. So prosecutors can today, on their own, without a single change of law, really both stop the funnel into the jails by changing their bail practices, their plea bargaining practices, but they could also file motions to get people out of jail, right? Who are about 500,000 people in the United States today are in jail, even though they haven't been convicted of a crime. Our estimates is several hundred thousands of those are in because of inability to afford cash bail. Tomorrow, today, if a prosecutor wanted to get these folks out, they could file motions to get them out. Sheriffs also have a ton of discretion when it comes to jail practices. So there are a lot of stakeholders that could act, but again, the number one person in your state who's the most important right now in this area is your governor and your chief justice.
We get a question about, how much time does somebody have to be left on their sentence before they can be considered for release? And again, this is a state-by-state process. As I mentioned, in Pennsylvania, they're looking at people who have a year or less left on their sentence. The governor of Kentucky, Governor Beshear, as Udi mentioned earlier, just granted, I think, 128 or something commutations. Those also were people who were at the end of their sentence. So in some ways, that's how governors are approaching this, is focusing on those who are closest to the door under the idea that they're the least likely or they're the lowest risk. Whether that's true or not, I'm not sure, but they're doing some sort of analysis. So I think that's the easiest probably politically to justify, but there's no rule on that. I think in terms of the home confinement we're seeing at the federal level, I don't know that it's necessarily how much time you have left. I think they're looking at risk factors. I think they are looking at elderly people and pregnant women and others. So there's no hard and fast rule on that, and it's going to depend on the state you're in.
Yeah, so just, the argument that we've been making in our model executive order and our model, in our letters that we've been sending is that if you have an underlying condition, if you've been identified by the CDC as particularly vulnerable to COVID-19, we've been making the case for anyone who has 2 years left. Again, that's a broad swap. We decided to start big. If someone just fits into the category of elderly or has a condition, but it's not a chronic condition, then we're saying focus more on anyone who has like a year left or 6 months left.
Got a question about, that's the governors who are not acting. And I think we've tried to address that.
Vast majority.
Well, and there's been some disturbing things, right? I mean, we've seen Governor Ducey, we've seen Governor DeSantis basically come out and say, I'm not releasing people.
Abbott, the way he's Governor Abbott in Texas right now is making the case to to make bail practices even worse, to not, to prevent people who are even eligible for cash bail and can pay cash bail to prevent them from coming out. So I think Governor Abbott has actually been the most aggressive against getting people out of even jails, which has been kind of the low-hanging fruit for most other governors.
Yeah, somebody asked about how are they going to do this at the federal level because they're in lockdown for 14 days. Actually, what we're hearing today is that the people who are getting called are being sent to quarantine for those 14 days because that was the process laid out in Attorney General Barr's directive anyway, was that before somebody got released, that they would go into quarantine for 14 days before they went out to the community. Of course, I'm sure their thinking is they do not want to send people who are infected into the community. This is, an effort to stop the spread. And so that makes some sense. But so I don't think the lockdown is going to stop that process from going forward. We have concerns about the lockdown and how that may affect us getting in touch with people who we're trying to match with lawyers to apply for compassionate release, because we need those people to be able to have access to the phone and take legal calls and to talk to their attorneys so that we can file, so that those attorneys can file on their behalf. So we're watching and we're learning a lot from you all on how the quarantine is being implemented and what kind of access people have to the phone and email. Do you have any thoughts on the federal lockdown?
Yeah, no, it's the same. Look, I get the rationale to make sure that people are, in the same way that me and my family, we self-quarantined, right, for 14 days. But our worry is that it could potentially make the spread worse if without proper, obviously, social distancing. And it's the communication lockdown that we're worried about, right? That we're not going to be able to communicate with people in prison.
Yeah. A couple others. One, people are asking us to address the lack of transparency in prisons. This is an evergreen problem. But I don't blame people for being angry about this. Your loved one is in the custody and care of the government, and you are not getting information, and you're hearing conflicting information, and you're hearing people say that guards aren't wearing masks, that they're being, I know at the halfway houses, I've been screaming bloody murder about my friend who's at the DC halfway house at Hope Village, and they're locked in their rooms. They're not getting any time outdoors. And then when they go to meals, they're packed in like sardines. And so it's just maddening. I know that the Washington Lawyers Committee and others have filed a lawsuit against Hope Village. And I think, all you can do really, and I'll say this, the press is watching this. So a lot of you know this. We reach out to you when you share your stories and we ask if we can share that. Your stories and experiences are what allow us to bring attention to things. We've talked to the ACLU about what's going on in Oakdale because you have reached out and told us about your concerns about your loved one who has not been infected, but you're worried about that. And so that, they can consider action there. And so I would just say, use your voices. It's not only just, calling lawmakers. Sometimes it's calling reporters, writing letters to the editor, talking to us and others and saying, I need to get this story out. It's really, I will say the press is watching this. There's been a lot of stories about the dangers that folks in prison are facing. And they usually just want to make sure that they can put a human face to that story. So, please keep sharing your stories in the group, share with one another so that you're not getting rumors, because sometimes people post something, you know how inmate.com works. You hear something that goes around and then people react to that, but verify the things you're hearing so that we know what's true and not true, and we can get that out to folks.
Yeah, I want to give a shout out to one state that I actually think has been doing a good job keeping the public informed as much as it can, and that's Ohio.
Yeah.
In Ohio, they've started to release, I think, daily information about COVID infections, testing, people who have it or being tested for it. And it's been incredibly helpful for loved ones to be able to know what's happening. And so far, we've seen a lot of transparency in Ohio. And we've seen, Ohio also was one of the first states where local judges immediately began to change their pretrial detention practices. And we've seen hundreds of people get out of jail in Ohio because of their fast response.
Yeah, and the Ohio dashboard is particularly easy to read. Like I said, North Carolina said they're going to put one up. South Carolina put one up. We've written to expect. Pennsylvania has a good one. We've asked them to expand that. The federal government, BOP, surprisingly, had one up early, and that was good to see. I know people are concerned about whether that information is accurate. My sense is it's just behind because a lot of this requires self-reporting on behalf of officers, and so, and also, frankly, we don't know how many tests are being administered. So, without that, somebody will say, well, we have nothing in our facility. And yet we know from you all that people are sick, showing symptoms, guards are staying home and the rest. And that may just be a matter of testing. And so in the outside world, we're going to hear more about this as soon as there's more testing. But I think if you're in a state where they do not have a dashboard, and I'm saying dashboard, what that really means is a dedicated spot on their site where they're sharing, number of people tested, positive, negative results, quarantine, just sort of their process of what's going on. You really should keep hammering away at them. And like I said, we've wrote letters to Mississippi, Pennsylvania, North Carolina, which was responsive, Arizona. And I just want to repeat something. The states where transparency has been lacking before this, they're lacking now. There are some places that are not Florida should be more forthcoming about what's going on there. And we're not seeing it, and we have a right to demand it. So feel free to call. That's just the least they can do, right? I mean, for these states to say that we have it under control and your loved one's better off in our care, well, we want to have some accountability. And so they should be telling you what's going on in these facilities so that if that's not the case, we know what's happening because, if somebody leaves the prison and goes to a hospital and dies, and that doesn't sort of count as that was a fatality from the prison, then people aren't going to realize the extent of the neglect. But in some of these states, these governors have been slow to take precautions, even, with people on the outside. So it's not surprising that they've been so slow on the inside. Let me see, I'm sorry to have to read this, especially because I'm so old and I really should pull my glasses down to do this. Let's see, answer, but they're worried about staff infecting their loved ones or being, we've talked about this before, and I think this something Udi said about public health. There is this misconception or perception that, this is like a cruise ship analogy that, you have a quarantine population and it will run its course. That just neglects the fact that outside staff is coming in and out. And so you are not going to just have a pod that is infected and not get to the local community. So when we talk about addressing COVID in the prisons, it's because that's going to affect, corrections officers, their families, and the neighboring communities. These are not sealed off places. So I think that's really important. But the idea that, corrections officers have it and they may be transmitting it, that is absolutely a danger. But I'll say this, I worry about these facilities getting even more short-staffed and what that's going to mean, because if you have if you saw what happened in Italy where they had riots because officers were no longer reporting to work and the folks inside were just being locked down all day and their loved ones couldn't be in touch with them, it got very ugly. And I don't think that that's out of the question, in especially some of our local facilities where, you may have a couple people who work at the jail and they're infected and they're gone. And so it is a real problem, but again, that's where our interests are aligned. These folks should want to make sure that these populations are taken care of as well because they're at risk too.
Yeah, which is actually, you just reminded me something I should have said when the 14-day quarantine question came up. And this is a point that Cynthia Roseberry, who's the Deputy Director of the Justice Division, the ACLU, keeps making. And that is, great, we could quarantine or separate the incarcerated population, but the staff is still going to be coming in and out every day. So the fact that now we're going to, subject them to a certain type of quarantine, it's not as if they're still not going to come in contact with people who are still potentially carrying the virus, and they may not even know it. I mean, remember, about 25% of all people who are actually positive for COVID-19 may not show any symptom. So that's the other reason we're very concerned about the lockdown in the prisons right now, because you're still going to have staff coming in and out because there's no other way to do it that could potentially expose huge populations.
We had a question specifically about Mississippi. Folks who have been following FAM for the last year know that we called for an investigation at Parchman last May, repeated that in November. Then we had these tragic deaths that occurred starting at the end of December. Again, this is another example of a broken system being exposed by a big crisis. Mississippi was not treating folks well in the best of times, and I am very concerned about what's happening now. The governor has not been transparent or smart in terms of precautions for the general population, and I'm sure that that is translating into poor treatment inside. There was, I believe, the first test, positive test just came out yesterday, but again, that may just go to lack of testing. And so we don't know what the problem is inside yet. I think because there's litigation ongoing about Parchman, that people are going to be able to get discovery and look at this, because I know that this happened in Arizona. ACLU is running suit against the DOC there. I think DOC was just ordered to comply with an order to share how many people are vulnerable or have been exposed to this. So I think because there's been prior action, it may be easier to get some facts, but right now I don't blame people for being worried. Mississippi has shown no ability to take care of those inside their prisons. But, stay tuned. And like I said, track ACLU, follow us, stay part of the Families in Action group, and other people from Mississippi are there. They'll share actions. There's a Mississippi Prison Reform Coalition, Mississippi Dreams, prisoner advocacy organization that we work with. There are resources for you. Let me see, we're almost out of time. There's one other thing I wanted to get to. Being housed with somebody in Mississippi. That may be it. And I just want to repeat, if we didn't get to your question, or if you're watching this later, drop your question in the comments, and I or somebody else on my staff will answer it to our best of our ability. Also, we will share Udi's contact, not his contact information, not his home address, but we'll give you his way to contact the ACLU, and so that if you have questions that they may be able to answer, we'll do that as well. Udi, before I sign off, do you have any closing comments you want to make?
So, I've been thinking a lot about, is there a silver lining to any of this? And it's tough. It's tough to find one, but here's some days, depending on the mood I'm in, right? I feel hopeful in the following way. I feel like this may be remembered a year or two from now as the moment when the public and government stakeholders finally saw people who are living in prisons and jails as human beings, and that there was compassion finally applied to the millions of loved ones who are living, behind in cages. So we're seeing, what gives me a bit of heart is, even though we're not seeing nowhere close to enough action, we're at least seeing some action, even some significant action. And I'm hoping that this moment will be remembered as the time of the tipping point, where people living in prisons and jails were treated as human beings, as brothers, as sisters, as family members, as loved ones. So on some days, I am slightly hopeful.
Again, I really want to thank you, especially on short notice, and we were due to talk anyway. And so thank you for doing this, and you guys are doing great work. And obviously we'll be working together on this going forward. I want to say just a couple of things. stay focused. Like I said, the days when you want to take action, go to our resources page. Make sure you're getting letters into folks, making them aware. I will also say, I saw a news story today. I'm just outside Washington, D.C., and the mayor's talking about how, we have more time than New York has because our big time may be July or something. We'll still be getting hit by this. So I want to say is this may be more of a marathon than a sprint than we think. There's a lot of urgency right now to get people out, but we're not going to stop because I think this is going to change the conversation about why were these people in there in the first place. And I think that goes to Udi's point, which is, there aren't these emergency mechanisms right now and we need them. We keep saying, in case of emergency, break glass and pull this lever. We don't have that. Too many state systems don't have that ability. And so that's something we're going to address in the aftermath of this. But then lastly, I just want to give some unsolicited advice. I am not a psychologist or a social worker. And I will say we're actually thinking about trying to host a Facebook Live with somebody who can help folks deal with some of the stress. I can't imagine what you're going through. All I want to say is this. When I was going through my situation with my family, and I had 2 young kids when I went to prison, it was very stressful. And what I would say to you is try to shrink your field of vision to what's important right now. And your health is incredibly important. You're a better advocate and you're a better family member and a better neighbor and a better worker, everything, when you're healthy mentally. And I know this is an incredibly stressful time, but this is one of those times where you have to realize there's only so much you can control. I'm getting a lot of direct messages and emails from people saying, they're not sleeping, or Kevin, get my loved one out. There's no silver bullet here. Everybody's working as hard as they can, and you're working as hard as you can, but you've got to cut yourself some slack as well. Take some actions every day, make calls to your representatives, send letters, do what you can, but you also have to take care of yourself, and you have to give yourself space to know that you've done everything you can, and that some of this worry is not going to do you any good, or the loved ones who are in your life now that may be feeding off that anxiety. So I know it's easier for me to say because I don't have someone in right now, a brother or sister or father, mother, but I have had some taste of that. And I've had, my kids have to go through that. And all I would just say is self-care is not just a, popular expression. It is really important that you give yourself a break, that you do everything you can in a day, and then you take some time to make sure that, that you're healthy and that you're doing everything you can, not fighting just hard, but fighting smart. So with that, and thank you for indulging me in my pop psychology. We'll close with that. And again, thank you for everybody joining us. Leave your questions. And if we have future events, which I suspect we will make you aware of them. Thanks again to Udi. Thanks to our staff for doing a great job with this as always.
Thank you.